Okay guys, good evening all of you. Welcome to this INICET Predictor series, the part 2. Now the reason I am saying part 2 because we will also have a part 1 with my friend Dr. Kashish. He will be taking the part 1. So I am taking the part 2 where my basic focus will be on the second half of the PSM. Okay. Now INICET guys in this part is only talking about stats. Yes, so you are generally going to experience large number of questions from statistics. Yes. Now typically if you ask me, INICET tells you in a peak and trough pattern for stats and epi. Like in one session, if they ask you almost 5 to 6 questions in stats, in that session epi will be less. In the next session epi will go up and stats will come less. So you can see this is a typical feature of INICET. Okay, done. Now question 1, identify the relationship in the image. This image, if you ask me, is a scatter diagram. Now a scatter diagram typically tells you about relationship. Yes guys, so my MCQ is first is this relationship. This scatter diagram can give me a linear or can give me a non-linear relationship, or also can give me a no relationship. Linear relationship typically will be made something like this or something like this. These are linear relationships. Non-linear, they can be any other pattern like a snake or like this image, a non-linear relationship. No relationship, haphazard Brownian motions. These are no relationship. Classic question of INICET is this. Yes. So this answer was non-linear. What are the other questions related to this topic? Now guys, typically this topic, the brother of a scatter diagram is the regression line whose equation y is equals to mx plus c. So this is m, this is c, this is y, this is x. This m in my subject is called as R. Yes. So this itself was an INICET question where they had asked what is the equation of this line. Now the value of R ranges from -1 to +1. Another important MCQ. Minus tells about inverse relationship. If a pregnant female smokes, her baby's weight will be less. Inverse. It can tell you about forward relationship or direct. So basically it is something like this. Third, regression and correlation. Regression and correlation, they tell about relationship only. Remember, they will never tell you about association. Now, who tells you about association? P-value, which is calculated from statistical tests, odds ratio and relative risk. They do not tell about causation, which is told by the Doll and Hill criteria, and they do not tell about the absolute magnitude of variable. Now this brings me to the second question. A study finds a R of 0.7 between self-reported work satisfaction and life expectancy in a random sample of 5000 corporate workers with a p-value. What does this mean? 0.7. Yes, that means 70%. Yes guys. So 3.7, 4.7, absolutely not. They cannot be, because 70% is what I am bothered of. Yes. So in this question, because they have given p-value as well, and we know p-value tells you about association, the answer to this question was strong statistically significant association between work satisfaction and expectancy. Answer was 2. Answer to this question was 2. Answer, if it is a multiple answer correct, then the answer would have been 1 and 2. But if it is a single answer correct, the option number 2 is better than 1, because option number 1 talks about only relationship, whereas option number 2 talks about association and relationship both. I hope I am clear with this. Done guys? Over. Everyone is clear. I have explained why the answer is not 1, because it talks about only relationship, whereas 2 talks about association, which is superior to relationship, because you know the pathway RAC. R stands for relationship, A stands for association, and C stands for causation. Relationship is given by R, association is given by p-values. In stats, odds ratio and relative risk, this is the Doll and Hill criteria. I hope I'm clear with this, Priyanshu. I hope beta you got the answer. Done? Over boss? Okay. This brings me to the next question. You have been asked to design a study for a disease whose prevalence in the community is 10%. The alpha error is kept at 1%. The relative precision is at 20%. Power is 20%. They have asked sample size formula. Now, the first and foremost, because this is prevalence, what is the sample size formula for observational studies? So for observational studies, the formula of sample size is Z square PQ by D square. Now, the value of Z depends upon the value of confidence. So Z value of 1 is when the confidence is 68, a value of 2 when the confidence is 95, a value of 3 when confidence is 99. Blanketly we say that the most common is 95. Okay, no problem. But how to calculate confidence? It is 100 minus alpha. In this question, it is given 1%. So it will be 100 minus 1. So 99%. So my formula will be for 99%. So my formula will be 9 PQ by D square. I hope I am clear till this point. Now what is this D? This D talks about absolute precision. There are different types of precision. D is absolute precision. In this question, they say the relative precision of 20%. So if I have a relative precision and I multiply it with prevalence, I would get absolute precision. So in this question, my relative precision is 20% into prevalence, which is 10%. So 20% of 10% gives me an absolute precision of 2%. Now guys, power has nothing to do when we talk about sample size in case of observational studies. So now you can see my data is very categorically set because I am clear that I have a absolute precision of 2% and my sample size formula was 9 PQ by D square. Now let me put the values. So 9 into P, P is 10, Q is 100 minus P, that is 90, divided by D square, 2 into 2. So my answer will be 8100 by 4, 2025. Answer to this question was option number 4. I hope I'm clear with this. INICET loves to ask questions on sample size calculation. Only one formula, but the problem is we do not basically understand how it works. Yes, done, over, crystal clear, great. Question number 4. How to interpret this image? This image is an image of confidence. Now to interpret this image, we have 3 rules: rule A, rule B and rule C. Yes, now rule A, if Ci touches null value, it is statistically insignificant. Now please pay attention, touches the null value, it is statistically insignificant. Yes guys, done, over. Now when do we say it to be insignificant? When it touches null value. What is null value? When my odds ratio and relative risk is equal to 1. So basically when I drive a car, my null value is 0, 0 gear, I cannot drive a car. Similarly, in epidemiology and statistics, my null value is taken as 1. Yes. Rule B, more the distance of point estimate from null value, more is significance. More is the significance. Yes guys. Now, so if my odds ratio is 1, the odds ratio of e-cigarette is 1.4, the odds ratio of normal cigarette is 2.4, the odds ratio of BD is 3.4. So you can understand my BD smoking will be more dangerous. I hope I'm clear with this. On the other side, a odds ratio of 1, a odds ratio of diet and protection from colon cancer is 0.8, odds ratio of exercise and protection from colon cancer is 0.7, and an odds ratio of vitamin C and colon cancer is 0.4. So if it is 0.4, what is the protection? 1 minus 0.4, 0.6, that is 60% is my protection. Here 30% is my protection, here 20% is my protection. So you can see, more the distance of point estimate from the null point, more is the significance. I hope I'm clear with this. Rule C. The rule C is very small, smaller Ci, more significance. Ci is inversely proportional to sample size. Ci is inversely proportional to sample size. Yes, thank you Sameep. Yes, Campylobacter, I hope you are clear with it, beta. Yes. Now we have to apply these 3 rules in a sequence. Let us apply for this question. In this question, if you see rule A, touching the null value, so this study is insignificant, whereas rest all were significant. Yes guys. Now, second, look into the distance of point estimate. What is point estimate? This dot. So from the null value, the point estimate for D and C is maximum. Since the point estimate is same, the CI of D is smaller. The CI for D is smaller. Because the CI for D is smaller, the best will be D. Worst, it was E. Maximum sample size, CI is inversely proportional to sample size. In this question, whose CI is smallest? A. So A will have maximum sample size, or F. Now if you are in a hurry, you will do this mistake. So it was F which has got the smallest CI. So it has got the maximum sample size. Minimum sample size, you can easily see it is E. So answer to this question was option number 3. I hope I am clear with this. Guys, this has become a bread and butter question for the INICET exams these days. And in the same image, they will put a diamond and make this image into a forest plot, which typically is used in a systematic review and meta-analysis. Yes, done. Happy all of you. No problem at all. Great. Superb. Yes. Question 5. A study is undertaken to determine whether drinking more than 8 cups of coffee a day is associated with hypertension. The BP readings were taken of the person who drink more than 8 cups and who do not drink coffee. The results are as following. Which of the following is the most appropriate test to identify this? So you have a 2 by 2 table. We have some options. Let us see. Approach to questions on statistical tests. Now you need to do 4 steps. First step, number of groups. The number of groups are 2 or more than 2. Like in this question, drinking coffee, not drinking coffee, 2 groups. Second, you have to determine whether it is paired or unpaired. In this question, if you see, drinking coffee, not drinking coffee. Suppose I am drinking coffee, your friend Priyanshu does not drink coffee. So this is unpaired. So it is unpaired. Yes. So it is 2 groups, unpaired. Output variable. We have taken BP yes or BP no. So this is quali. Now majority of students get bold with a googly over here because they think it is quanti by seeing numbers. Please remember guys, only numbers refer to frequency or sample size, whereas number plus metric scale will make it a quanti variable. What does it mean? If the same question would have been coffee yes, coffee no, systolic blood pressure and standard deviation, both of which written in mm of mercury, 140, 120, 10 and 5, then this variable which you see would have been quanti. Yes guys, but in this question, because I have taken BP yes or no, it is quali. Now the moment it is quali, 99% times answer is chi-square. But this is INICET. Since this is INICET, when in the 2/2 table of INICET, any value is less than 5. So, any value in chi-square 2/2 table is less than 5. We do the Fisher exact. We do the Fisher exact. Yes, guys, done, over. Whereas, if this would have been the question where I would have taken quantity data, then my answer would have been something else. It would have been unpaired t-test. So guys, the beauty of statistical tests is this: with a single change, your entire answer can change in no time. Yes, in a single change, your entire answer can change in no time. I hope I'm clear with this. Done, guys, over, no problem. Yes. Now, question 6. A researcher group conducted a placebo-controlled clinical trial to assess whether a new drug to treat acute migraine with or without aura in adults is more effective than a standard therapy. A total of 3,500 patients with acute migraine were enrolled in the study and randomly assigned to either the new drug or standard treatment. During the data analysis phase, the researchers decide to set the alpha at 0.01 rather than 0.05. What will be the most likely result? Excellent question. Yes, yes. Now, absolutely right beta Priyanshu. अगर before after दे रखा है वो paired होएगा. Like you measure my heart rate, it is 200. You give me a propranolol, after 30 minutes you again measure my heart rate, it is now 100. Before drug, after drug, then automatically it will be considered to be a paired data. Yes. Now let us look into hypothesis testing table. So when we talk about the hypothesis testing table, we have a 2/2 table again. Null hypothesis, suppose drug 1 equal to drug 2. Alternate hypothesis, drug 1 not equal to drug 2, and suppose drug 2 is better. H0, HA, H0, HA. Now guys, any drug trial is first done on animals and then it is done on humans. So RCT is done on humans, reality is done on animals. Look into cell number 1 and cell number 4. Cell number 1, in reality, drug 1 equal to drug 2. That is, when I did the study in animals, I found out drug 1 equal to drug 2. In RCT, again, I got the same result, drug 1 equal to drug 2. This is called as confidence. Yes, guys. Cell 4. In reality, I got alternate hypothesis to be true. Drug 1 not equal to drug 2. Here also I got drug 1 not equal to drug 2. So in both I am getting drug 1 not equal to drug 2. It is power. So what was cell 1? In both H0 is correct. This is called as confidence. In both HA is correct. This is called as power. Let us look into the cell number 2 and cell number 3. Cell number 2, in reality both the drugs were not same. Yes, reality both the drugs were not same. You made a mistake and proved both of them were same. Yes. So here you made a mistake. So since it is cell number 2, it is type 2 error. Cell number 3, in reality both the drugs were same. You made a mistake and you proved both the drugs were not same. So this is type 1 error. Type 1 has many synonyms: alpha, p-value, false positive. So alpha is 1 laddu, false positive is 1 laddu, p-value is 1 laddu. So type 1 also calls it false positive, also called as alpha, also called as p-value. Whereas type 2 is also called as beta, also called as false negative. So type 2 also called as beta, also called as false negative. These are easy ways to remember the synonym. I hope I am clear with this. Done. Over. The sum total is 1. So confidence plus type 1 is equal to 1. So confidence will be 1 minus type 1. Similarly, power is 1 minus type 2. Power is 1 minus type 2. In this question, they say they have reduced the alpha. Now, you can see from my mnemonics over here, alpha is related to type 1 error, false positive, p-value, whereas beta is related to type 2 or false negative. Power is 1 minus type 2. Confidence is 1 minus type 1. Yes, in this question, they were talking about alpha. Alpha is nothing to do with power. So option 5 gone. Alpha has nothing to do with type 2 error. Option 4 gone. Confidence is 1 minus alpha. In this question, you have dropped the alpha. So confidence has gone up. So answer to this question was option number 1. Look into the option 2 and 3. Higher probability, both are wrong. Now I will explain in one go only. See, my alpha, which was 0.05, I have reduced it to 0.01. To get a significant result, I know that p-value should be less than or equal to alpha, then only it is significant. I know this. Now in this question, because it was 0.05, even if I would have got a 0.04 as value, it used to be a significant result. Now if I have dropped the alpha, I need to drop the p-value as well. So the p-value also needs to go very low, which is practically very tough because p-value is the actual number of mistakes made. So the probability of getting a type 1 error will be less. The probability of finding a significant result will also be less. I hope I'm clear with this. All the 5 options I've explained in a very simple manner for every one of us to pick it up. Question 7, a bread butter question of this topic. A randomized control trial comparing the efficacy of 2 drugs showed no difference. Assume that in reality there is. This example is this. Now again it comes from the same 2 by 2 table. But how to approach such question? So approach to questions on hypothesis testing. Now, in such a scenario, the first step, read the question carefully. If you don't do this, guys, you are dead. Once you have read this, decide in reality and in RCT which hypothesis is true. Second, draw perpendicular lines. It will give you the answer. In this question, it says, in reality, the 2 drugs do differ. So, HA is right. In RCT, no difference. H0 is right. Now guys, if you cannot pick up this, trust me, it is impossible for anyone to ever solve this question, because what is null hypothesis? When drug 1 equal to drug 2. What is alternate hypothesis? Drug 1 not equal to drug 2. Yes, done. So I draw a 2 by 2 table. H0, HA, H0, HA. We have reality, we have RCT. Here in reality HA is true, in RCT H0 is 2. Answer to this question was option number B, type 2 error. I hope I'm clear with this. Done guys, over, fantastic. 1 minus type 1 was confidence, 1 minus type 2 is power. So if I just change the wordings of the question, the answer of this question will totally change. Done, over, finish guys, cool. Question 8. Which of the following about a Delphi's method is true? INICET asking questions from communication chapter is only Delphi's method. Now let us see what is a Delphi's method. So in a Delphi's method, I have experts who are independent, who are geographically dispersed, and brought to consensus. This is theory. As a student, very difficult to pick this up. Let me use an example to explain this. Yes, I have to select a cutoff of SpO2 for COVID admission. Yes, suppose this is my question. I go to HOD sir of medicine at AIIMS. I ask him what is the cutoff. Sir says 96. I go to the HOD sir at PGMI Chandigarh. Sir says 95. I go to HOD madam at JIPMER. Madam says 94. I go to HOD madam at NIMHANS. Madam says 94 to 96, anything will work. Now if you see, you will see similar cutoffs but not same cutoffs. We cannot run clinical practice like this. So I again go to HOD sir and say, sir, 96 is more, reduce. 95. 95 pakka? Yes sir. 94 is less, so we put it at 95. 94 to 96, ना आपका ना मेरा 95 पे done करते हैं. Now you can see, now all the faculty members are being brought to a consensus, that is 95 only. Yes guys, this is what is a Delphi's method. So the method involves formation of a team to undertake and monitor at Delphi. Yes, because this cannot be done by a one person. Second, there is panels who are experts. Yes, first round of Delphi will definitely be development of a questionnaire, because we will use that questionnaire to bring out a consensus. Answer to this question was option number 4. I hope I'm clear with this. Done guys, over, finished, no problem guys, absolutely clear. Generally this is a topic which we do not read. An examiner is very happy to ask a question from this topic. End of the day. Question 9. You are a medical officer at a PHC. 50 patients requiring antihypertensives are being transferred to your PHC from the periphery. 40 need amlodipine, 5 mg per oral. 10 people have a contraindication to use amlodipine, so those people have to be started on lisinopril 10 mg per oral. Yes, drugs come to the PHC once a month. What should you be doing? Okay. So for amlodipine, I have 40 persons taking 1 tablet a day. Yes, into 30. Shagutta, only Delphi's method is important for a communication topic for INICET. And that's the reason I was very clear with that only one topic. Yes. So total number of tablets needed will be 1200. When you talk about lisinopril, we have 10 patients who all will take one tablet for 30 days. So total is 300. So total number of tablets needed will be 1500. Now you can see over here it says once a month. Once a month. Now it is a fact that when we talk about once a month, the reorder factor for every month is 2. Now what do I mean by a reorder factor? Now imagine I order medicines on 1510, they have come. I have ordered medicines on 1511, they have come. I ordered the medicines on 1512, they didn't come because it was a new year and festive time. So again my medicine will come on 15th January 25. So you can understand for 1 month time there will be shortage of medicine and I cannot afford that. So what will I do? The basic thing I will do over here is, to be safe, I will always over order. How much over order? That is what is called as reorder factor. So the reorder factor is 2. Here the number of tablets were 1500, the reorder factor being 2. So 1500 into 2. So number of tablets needed will be 3000 with the reorder factor being 2. I hope I am clear with this. Done? Over? Happy? Yes? Yes? Okay. Question number 10. Where is the cotton soaked in blood discarded? Yellow. Hospital waste management. Yes, congratulations Krishna. Sharps goes into white. Red, anything you want to recycle, it will go in red. The metallic body implants. The metallic body implants and glasswares go to blue. So answer to this question was yellow. Common controversies. In red we put gloves, plus minus stains. In red we put urine bags, whereas in yellow we put cytotoxics. Even if it is a vial of glass, still it is going to go to yellow. Yes. And also blood bags. Yes guys, this is all about the INICET Predictor series. I hope you have enjoyed it. I put up my Telegram group and Insta channel link. You are most welcome to be a part of it. Yes, thank you Krishna. Yes, and I hope others who have a part of this session have enjoyed this session. These are important topics of part 2 PSM. Part 1 will come up with my friend Dr. Kashish. So do wait for that. Remember, in AIMS, PSM is all about epi, stats, screening, newer updates and vaccines, newer programs, only things like this. Yes guys, done, over. See you guys. Bye bye. Good night. Enjoy the time. Take care.